If you're over 70 and still driving, what I'm about to tell you could affect your ability to stay on the road in 2026. The DMV just confirmed sweeping changes to senior driver licensing rules, and thousands of older Americans are completely unaware of what's coming. We're talking about mandatory vision tests, in-person renewals that can no longer be done online, and even behind-the-wheel evaluations in certain states. Some drivers are already receiving notices in the mail, and many are panicking because they don't know what to expect. Here's what makes this so urgent. These aren't just minor policy updates. States like California, Florida, and Texas are implementing strict new requirements that could determine whether you keep your independence or lose your driving privileges. We're seeing shorter renewal periods, required medical clearances from your doctor, and cognitive assessments that weren't necessary before. But here's the thing. Most seniors won't find out about these changes until it's too late. Until they're sitting at the DMV being told they can't renew without additional testing. That's why I'm breaking down everything you need to know right now. Which states have the strictest rules, what tests you'll actually face, and most importantly, how to prepare so you pass with flying colors. This affects millions of American seniors and their families. If this information helps you or someone you love, smash that like button right now, so we can get this critical message to every senior driver who needs to see it before these rules take effect. Let me tell you something that's happening right now across America that barely anyone is talking about. But it's going to impact millions of senior drivers in ways most people haven't even considered yet. I've spent the last several weeks digging through DMV documents, talking to licensing officials, and researching what's actually changing for drivers over 70. And what I've discovered is both more complicated and more important than those sensational headlines suggest. First, let's get one thing absolutely clear, because there's a lot of misinformation floating around online right now. There is no single nationwide rule that's suddenly making it impossible for people over 70 to drive. That's not how our system works. Each state controls its own licensing requirements, and what we're actually seeing is a patchwork of changes happening across different states, some more significant than others. But here's why you still need to pay very close attention. The trend is unmistakable, and the direction we're heading is toward stricter oversight of senior drivers across the board. The reality is that several states have already implemented or are in the process of implementing new requirements specifically targeting older drivers, and these changes are based on legitimate safety data that shows certain age-related changes can affect driving ability. Now, before anyone gets defensive, I want to emphasize that age alone doesn't make someone a bad driver. Some of the safest, most conscientious drivers on the road are in their 70s, 80s, and beyond. But statistically, there are certain medical conditions and physical changes that become more common as we age, and lawmakers are responding to that data. Let's talk about what's actually changing in specific states, because this is where it gets real. California, which has one of the largest populations of senior drivers in the country, has tightened its renewal requirements considerably. If you're over 70 in California, you can no longer renew your license online or by mail. You must appear in person at the DMV, and you must pass a vision test every single time you renew. They've also shortened the renewal period for seniors, which means you're going to the DMV more frequently than younger drivers. This isn't just an inconvenience. For seniors with mobility issues or those living in rural areas far from DMV offices, this can be a genuine hardship. Florida has taken a different approach, but one that's equally significant. They're requiring more frequent vision tests and have implemented a system where doctors can report patients they believe may be unsafe to drive. This creates a whole new dynamic where your physician becomes part of the licensing process. If your doctor has concerns about your cognitive function, your medications, or any condition that might impair your driving, they can notify the DMV, which can then require you to undergo additional testing or even suspend your license pending evaluation. Texas is looking at mandatory behind-the-wheel driving tests for license renewals after age 75, though the implementation details are still being worked out. Illinois already requires drivers 75 and older to take a road test at every renewal, and they've reduced the renewal period to 2 years instead of 4. New Hampshire mandates that drivers over 75 renew more frequently and provide medical certification in certain circumstances. Now, here's what makes all of this particularly challenging. The cognitive assessments that some states are implementing or considering. These aren't just simple vision tests or basic written exams. We're talking about evaluations that test reaction time, decision-making ability, memory, and spatial awareness. For someone who's been driving for 50 or 60 years, the idea of having to prove their competence through formal testing can feel insulting and anxiety-inducing. But from a public safety perspective, officials argue these tests can identify drivers who may be experiencing early cognitive decline that they themselves haven't recognized yet. The truth that nobody really wants to confront is that this issue sits at the intersection of several deeply important values that sometimes conflict with each other. On one side, we have independence and dignity. Driving represents freedom, especially in a country where public transportation is limited or non-existent in many communities. Taking away someone's license can effectively end their ability to live independently, get to medical appointments, shop for groceries, or maintain their social connections. The psychological impact of losing your license can be devastating, and studies have shown it can lead to depression, isolation, and faster cognitive decline. On the other side, we have legitimate safety concerns. The statistics show that drivers over 80 are involved in fatal crashes at rates comparable to teenage drivers when you adjust for miles driven. Age, related changes in vision, hearing, reaction time, and cognitive processing are real factors that can affect driving safety. And unlike younger drivers who tend to take risks intentionally, older drivers may not recognize that their abilities have declined until after an accident occurs. What makes this situation even more complex is that there's tremendous variation in how individuals. Some people in their 80s have the reaction time and cognitive sharpness of someone decades younger, while others experience significant decline much earlier. A blanket policy based solely on age doesn't account for this variation, which is why many advocacy groups for seniors argue that any testing should be based on individual ability rather than arbitrary age cutoffs. Age. So what can you actually do if you're a senior driver, or if you have aging parents who are still driving? The first and most important step is to find out exactly what your specific state requires. Don't rely on social media posts or sensational headlines. Go directly to your state's DMV website or call them to ask about requirements for your age group. Find out when your license expires, what you'll need to bring to renew it, and whether any tests will be required. Second, be proactive about your health and your driving abilities. Schedule regular eye exams and make sure your vision correction is up to date. If you're experiencing any changes in your vision, reaction time, or cognitive function, talk to your doctor honestly. It's much better to address these issues before they become problems on the road. Consider taking a defensive driving course specifically designed for senior drivers. Many insurance companies offer discounts for completing these courses, and they can help you refresh your skills and learn strategies for compensating for age-related changes. Third, and this is crucial, start having honest conversations with yourself and your family about driving. Create a plan for what you will do if and when the time comes that driving is no longer safe. Research alternative transportation options in your community. Look into ride-sharing services, senior transportation programs, volunteer driver networks, and public transit options. Having a plan in place reduces the fear and anxiety around potentially losing your license. Here's something else that's important to understand. These new requirements aren't going away. If anything, they're likely to become more widespread as more states look at the data and decide to implement similar policies. The senior population is growing rapidly, and with it, the number of older drivers on the road. Lawmakers are under pressure to address road safety, and tightening requirements for senior drivers is seen as one way to do that. But there's also a growing recognition that we need better solutions than simply making it harder for seniors to maintain their licenses. Some states are exploring graduated licensing systems for older drivers, similar to what exists for teen drivers, where certain restrictions might apply before a full license. Suspension. This could include limitations on night driving or highway driving while still allowing someone to drive locally during daylight hours. Other innovations being discussed include more sophisticated testing that actually measures driving relevant skills rather than just using age as a proxy, and better integration between healthcare providers and licensing authorities to identify at-risk drivers earlier. The medical community is also getting more involved in this conversation. There are now tools and assessment protocols that doctors can use to evaluate whether their patients are safe to drive, and there's increased training for physicians on how to have these difficult conversations with their patients. Some healthcare systems are even creating driving assessment programs where patients can be evaluated by occupational therapists who specialize in driving rehabilitation. Technology is playing a role too. Modern vehicles come with safety features like automatic emergency, braking, lane departure warnings, blind spot monitoring, and adaptive cruise control that can help compensate for some age-related declines in reaction time and awareness. Some experts argue that rather than focusing solely on restricting senior drivers, we should also be ensuring they have access to vehicles with these advanced safety features. What frustrates me about a lot of the online discussion around this topic is how polarized it becomes. You have people who think anyone over a certain age shouldn't be driving at all, and you have others who view any testing requirement as age discrimination. The reality is far more nuanced. We need systems that protect public safety while also respecting the dignity and independence of older adults. We need policies that are based on actual driving ability rather than assumptions about age. And we need communities that provide viable alternatives to driving so that losing a license doesn't mean losing your independence entirely. If you're watching this and you're concerned about these changes, the best thing you can do is stay informed and stay proactive. Don't wait until your license is up for renewal to find out what's required. Don't ignore signs that your driving abilities might be changing. And don't be afraid to advocate for yourself and for sensible policies that balance safety with independence. This is an issue that's going to affect more and more families in the coming years, and we need thoughtful solutions that work for everyone. Claude is AI and can make mistakes. Please double-check responses.